fostering deeper relationships, influencing behavior change, developing resilience. You're about to start winning. Here is your host, Christine Bright.
Welcome to Parenting Game. I am so glad you are here. Well, it's fall and sports are gearing up again. And it's important to know what to do to help prevent injury or what to do when an injury happens in your child. I have Kari Martin as a guest today, owner of Streamline Physical Therapy, who is going to give us some great information on this topic. Kari, thank you so much for being here.
Yeah, of course.
And I'm just excited to connect with you again.
Yeah.
We were colleagues, I don't even know, 5 years ago, maybe now.
It's been a bit.
And I just always had loved working with you. So I was excited to hear that you had opened up your own physical therapy office and doing things on your own, and that you were willing to come in and talk to us today.
Yeah.
And you have a very unique approach. But before we dig into all that, you have another side that you're heavily involved in.
Yes.
Swimming.
Yes.
So tell us a little bit. I know you were a swimmer. You coach swimming. Share with us that part of your life.
Sure. So I got into swimming as a youth athlete, actually kind of late. I took lessons forever, but as we were trying to kind of find the sport that I was going to be good at throughout, my dad kept me in swim lessons all the time because I was kind of bad at everything else. And so I got into competitive swimming when I was 12. And did that all the way through high school and sort of fell in love with the sport. And I think because I started and sort of specialized pretty late compared to a lot of other swimmers, I didn't burn out of it like a lot of my friends kind of did around me. Mm-hmm. So once I graduated from high school, swimming in college wasn't going to be a plan for me because of college and the demands and all that stuff. So I started coaching, and I have now, this will be my 20th year coaching swimming.
Oh, wow. So do you coach competitive swimming or club swimming? Share a little bit more about that.
Sure. So I coach in a summer league pool, Ridgewood Pool on the Madison Southwest side. And then I also coach high school for the women's and men's teams at Memorial High School. I'm the assistant coach for both programs.
Oh, nice. So what was your favorite stroke to swim?
Well, I have kind of spanned everything, but I sort of fell into specialization as a butterflyer when I kind of got in and got started. And then I sort of suffered an injury in my sophomore year of high school and turned more towards mid-distance and distance freestyle, and that's what I love to coach now.
Oh, that's awesome. I have to say, I did get into swimming a little bit in high school, and the butterfly I liked, but I was more of those shorter. I was always impressed with, the ones who are doing like the 400s and stuff. And I'm like, 100, 200, and then I'm good. But I always did like that stroke the best.
Yeah.
I was never very good at the backstroke. Could not keep myself straight. And it was this whole thing. Just never could do that one girl. And that was another one.
Yeah.
You just see people just straight as an arrow cutting through that water. I'm like, how do you do that?
Everybody has their skill sets,
Yeah. Oh, that's great that you're just involved and have that other outlet in the community. Do you like swimming just for the heck of it?
So I actually just recently got back into swimming. So I started a master's program sort of in the middle of winter as another way to kind of just do something myself. Otherwise, I sort of turn into a hermit in the wintertime, and I'm not into snow and all other kind of Wisconsin things. So I started a master's program and have really been enjoying that. It's twice a week, and it's been really fun.
Oh, that's great. And I know too, we got, back when we were colleagues, you're doing a lot of work on the house.
Yeah.
And so I had some hacks for you because I had already done some of the type of projects that you were doing. So it was always interesting to hear of how it's supposed to be a quick project, and now 2 weeks later,
right, or 3.5 to 4 years later now, it's a whole mess.
They can last so long. Okay, so it's time for the chocolate challenge.
Excellent.
My favorite part. So, my mom, aka my producer assistant. Have we settled on a name yet, Mom? I don't think so. Okay, so we're going to give it a shot, and then we got to get it. Supposed to have a specific, unique flavor. And we'll see if we can pick it out. I mean, it's chocolate. Oh, no, know, I'm getting a little something.
Kind of.
What did you say?
Licorice-y.
Ooh, licorice. Well, now that you say that.
But coffee or?
I don't know, there's something earthy. It's got an earthy to it. But I can't say any, no, coffee. That might be a good one.
It's like a thing I know that I've had before, but can't.
Can't put a name on it. Okay, Mom, you're going to have to help us out.
Okay, it's sweet curry with saffron.
Oh yeah, never in a million was I close.
No. But the curry, I guess I can kind of, now that now that you know what it is, it's like, okay.
That's delicious.
I know. Need to have more out here. Maybe we'll just do like eat chocolate through the whole episode one time.
That would be fine. You can bring me on for that.
Okay, bring me on for that one. All right. Cleanse the palate here a little bit. Okay. Physical therapy, OT.
Yeah.
So a lot of times people get those confused.
Yeah.
But they are unique. And they both have different goals.
Absolutely.
So please share with us the difference between those two.
They're much more easy to differentiate when you're in like an inpatient situation, sort of like acute care setting. So they kind of differentiate to be like shoulder down for OT, whereas PT kind of deals with like if you have had knee surgery or hip surgery or back surgery, some things like that. In that setting, there are also OTs are much more concerned with like your, getting your ADLs back, which just means your activities of daily living. So being sure you can get dressed, get your shoes on, get to the bathroom, take a shower, cook, all those kinds of things that you have to be able to do to return back to a home setting. So that's more inpatient or like a rehab setting. In an outpatient setting, OT focuses much more on like fine motor skills, right? So there still might be a little bit more of the specialization with like shoulder, elbow, wrist, hand things, but it would be much more like the fine motor skills. So if you have trouble writing or pain with like needlepoint or knitting, those kinds of things where the anatomy and function of your hand is so specific and complex, whereas physical therapy deals much more with the gross movement motor patterns. So big motions, jumping, running, leaping, sitting, standing, all those kinds of things. So fine motor to gross motor skills is a pretty easy differentiation for OT.
And there can be situations where you're getting both.
Yes.
Depending on what the injury is, what you're recovering from, what the goals are.
Absolutely. And that's not to say, too, that PTs won't work on shoulders or elbows or wrists or things. They certainly can do that, as well as OTs, specializing in people that have had concussions or, speech disorders and mental things. So there can be a little bit more crossover once you get into like outpatient or performance land. But there tends to be that delineating line.
Okay. And you have a specific focus. And as we talked, you also have a passion.
Yes.
And with that focus
Yes.
of what you do at your clinic. Let's delve into a little bit of that, because we all typically know that you go to physical therapy after you've had an injury or you have back pain or a strain. But you have a unique approach.
Yes.
So share with us about that.
So the American society, as we know, is very reactive in regards to its healthcare problems. People tend to wait for something to happen, and then maybe they'll ignore it for a little bit, thinking that it will go away by itself. Whereas my whole model is sort of built on getting ahead of those injuries before they happen and taking much more of a proactive approach to that. So if you're thinking, you're a runner and maybe you want to run a marathon in the fall or in the winter in this situation, or maybe you're planning now for one that's in the spring, then you would want to come in and get assessed to see if you have some limitations in your mobility or some strength deficits to set you up for a program so that you're able to get on top of those things before they're an issue. So maybe you have to strengthen your hips or like work on your ankle mobility before you start increasing in your mileage. And what the plan is to like help people stay active and be active, whereas if they get hurt, oftentimes the result is that they have to take time off, and you take time off in relative rest. If the doctor will say take 2 weeks off, then you can't do anything in that time, and you're going to lose strength and mobility because of that. So in trying to get in front of those things before they happen, it's going to allow people to continue to do the things, that they love to do and are passionate about themselves.
That is a big mindset shift.
Yes.
Because it's like we wait until something bad happens
Right.
and then we go fix it. Even though if we may be noticing, it's like, oh, I'm a little tight or I feel a little bit of strain. And then we can also go, wow, just work a little harder and work it out. And I learned so much in the business about how you strengthen muscles around, the weaker muscle. And it was just so intriguing. I want to get a little bit, more specific into when some cues, give us some cues, like if you notice this when you're running or what, this would be a good time to come in, and I'm assuming you just do an assessment and see what's going on with them. So what are some good cues where it should be, okay, it's time to be proactive?
Sure.
Because otherwise you may be paying the price on the other end.
Yeah. So the big thing that I oftentimes tell my athletes and people that I'm working with that are trying to work their way back from an injury is knowing what is the difference between what's soreness versus what's hurting, right? So if you're getting stronger, you're going to go lift, or you're increasing mileage, you might have some soreness associated with that because your body's adapting to the different demands that you're placing on your joints and tissues and all those things. That said, that soreness should kind of go away in a way that seems reasonable, right? So if you have DOMS or delayed onset muscle soreness after like a heavy lift and you squatted more than you typically do, that might start a little bit after your workout and then kind of be an issue for 12, 24, even 36 hours after that. But after that, it should feel better, right? But if you have sharp, acute pain, that's not sort of the generalized soreness, and you can point to a specific spot. It hurts right there. It feels like a knife. That's something that's not normal or associated with, building strength or kind of increasing your demands. And it's indicating that there's something, I don't want to say wrong because, you want to get away from that, but something's not working the way that it should be.
Okay. And I think about that. It's like I've had, you rub, like my muscles are so sore, but then you have those times where you grab yourself and it hurts right here.
Yep.
So that's a cue to look into some PT with that. So what about, as you said, you want, especially with kids, so we're going to kind of drill down to that. Kids aren't good about telling you when they're hurting or when they're sore, maybe because they don't want the parent to pull them out of the sport, whatever the case may be. How can parents work with their kids if they're not getting those cues and that information? What should they do? They know, okay, my child looks like they're really going to be a baseball player.
Sure.
And we're going to be doing camps, during the winter and then the season. Please give some advice for parents on how to keep their kids healthy and be proactive with physical therapy.
So my best advice for that is to stay in touch with your kids, stay in touch with their coach, and kind of keep those communication lines open, because sometimes during a practice, I don't know many parents who are going to sit around and watch an entire practice, especially while it's colder out, and keep eyes on everything that their kid is doing in that time. But you might not pick up on some of those cues that, if you see a kid rubbing their shoulder after throwing, a lot of times it might just be soreness from that, but if they're going to say something, it might be to the coach because it's a different adult in their life, right? But you can also pick up on some of the other cues. Like if your kid has always loved going to practice, always loved participating in games and drills and all those things, but all of a sudden they kind of don't want to go, or they're showing some hesitation before other kind of activities, that's kind of a cue that something might be going on as far as that goes. But staying and keeping those communication lines open is really the best way to do, and just kind of check base pretty regularly so that you know what's going on.
So is it helpful for parents to even bring in, for a wellness check, so to speak, to the physical therapist and say this is the sport that they're going to do and kind of check them out?
Yeah, absolutely. I would say, when kids are young and they're kind of trying out a lot of different sports and kind of figuring out what it is that they want to do, or if they're going to focus more in on one thing than the other one, as the season is building or even before the season starts, have them kind of come in and see what their range of motion is like, see what their mobility is like, see what their strength is like, so that you can kind of have eyes on and know what their baseline might be, so that if something does happen down the road or something is popping up where they're having having some pain and soreness that's not associated with like the strengthening and the increased demands, then you can have something to compare that to, so you know what needs to be worked on specifically.
Okay. And then do you also help parents come up with a plan? Because when you specialize in a sport, you know, and again, we'll just use baseball because everybody's very familiar about it coming to light that these kids were really doing a lot of damage to their shoulder by pitching too much. So if you know they're going to be in a sport and using certain muscles all the time, can you help them come up with a plan to find activities that are going to offset and strengthen those other muscles so this one doesn't just get, you know, burnt out?
Yeah, it's a lot to do with like recovery in between, you know, heavy throwing days, as well as load management. So baseball players are a great example, right? So oftentimes you're getting into like those teenage athletes who are throwing and they want to go out and throw as hard as they can every time, especially if there's a monitor that's showing them their throwing speed, right? They're going to try to put up a higher number every time they hit the mound, or they're going to try to hit a higher number than like the guy who went before them, or the person who went before them, and just try to always one up one, other person.
Yeah.
I see it all the time.
Yeah,
right?
the competitive
and
piece.
You have to be like, the same thing with runners is not every run has to be an all-out hard effort run. There's a lot to be said for breaking it down into like the techniques and the drills and all of those things. But the recovery in between those, heavy days, you shouldn't be throwing really hard more than 2 days a week, in addition to like the game that you would have on the weekend or the tournament or what have you. So being sure that you're doing the what we call it prehabilitation exercises in between to, in the example of a throwing shoulder, to strengthen and stabilize your rotator cuff and to offload those tissues that, that so many strains and effort go through to sort of counterbalance that with the muscles that propel force through your body well.
So you can really be a partner to parents who want to have their kids healthy all through their sports career.
Yeah. And it's a partnership is exactly what it is. It involves the athlete, it involves the parents, it involves the coaches, it involves the PT or the AT, whoever is on your team. But it takes a village, as you know, right? And PTs want to be part of that village because it's so much easier to take care of things that happen up quick than it is, if something's been going on for months and years, and we all want to see the kids succeed and do well. So if we can get on top of it before it's an issue or prevent it from happening, it's better for everybody.
Well, and then preventing, surgery, the longer, you just don't want that to happen to kids while they're still growing
and developing. Yeah.
So the thing, doing PT to help minimize or, possibly even eliminate the chances of surgeries and tears is really important.
That's exactly right.
So share with us just, a little bit about like your background with PT, what your expertise is, because this isn't all you do.
Yeah.
People can come to you for PT for a wide range of reasons, adults and kids.
Yep.
One question, how young can parents start kids in PT?
So there is a branch of pediatric PT, for little kids. So you can start with birth to 3 at home if your kid has, certain developmental delays or cognitive delays. PT is a great spot for that, to kind of help build motor patterns and learn those neuromuscular facilitations of different activities, crawling, walking, all that kind of stuff. So I did my first rotation in a birth to 3, like at home PT situation for little guys. That was fun. It's different, right? So you can have PT for the kids that are that young. It's pretty rare to see, from like 3 to like 12. There's just not a lot of like sports related injuries that happen in kids at that time. That said, with kids specializing in sports earlier and earlier and earlier, we are starting to see more of a manifestation of like orthopedic and sports injuries in little kids. So I've seen, people with ACL tears and the surgery afterwards in the early teenagers, 13, 14 years old, which is super young, because you're still growing and developing at that time. I've seen, Achilles strains, ankle sprains, of course, concussions, for little kids. So you can, PT is a great spot for all of those kind of diagnoses. But generally speaking, once kids get to be, specializing in their sport, 12, 13, 14, kind of as they kind of get into high school and are really starting to be, it's becoming evident that, this is going to be like their main focus sport. That's when we'll see more more specific high school or teenage related injuries.
Okay, and then for you, so share with us when age, what can people come and see you for at Streamline?
Yeah, so any kid that has any kind of thing going on, I'm happy to see them. I'm happy to see athletes of all ages, right? And it doesn't even, athlete to me just means anybody who's working on a goal. If it's going to be hiking a through trail of the Appalachians, if it's going to be running your first marathon, if it's going to be, you're a triathlete and you've done 3 Ironmans, but you're still having stuff creep up because training for an Ironman is really hard, all of those kinds of things. If it's, basketball injuries, softball injuries, I love all of it. And I like to help people succeed in meeting their own goals. So I do have a background in swimming related injuries, but there's not anything that I won't try my best at. I like to think we've been pretty good at most of them.
Yeah.
So.
Well, I know I had a spill, tore my upper hamstring cross-country skiing. So excited, got the cross-country skis first time out. And, I didn't go to PT right away, and I regretted it because I know it took longer for me to recover. But again, you don't think, and, I think this is just another hurdle for people to get over, is that I'm hurting, so why would I want to do exercises?
Right.
So share a little bit about that, because we have this one hurdle, which you specialize in, is let's be proactive.
Yep.
Let's do some things before the injury starts, which is amazing. Then we have this other piece where people feel they get hurt, and I'm just laying around is how I'm going to heal. And we are finding more and more that is not good.
Right.
Just to sit.
Right.
So share with us a little bit about your approach to injury.
Sure. So what we're finding now, research just kind of keeps coming out and saying that strengthening and exercise and getting moving again is really the way of healing, your body. And of course, you're wanting to respect, if there's a fracture, you're obviously not going to be like getting out and running on a broken leg or broken foot or what have you, because that is what it is. But you may have noticed they're not, orthopedic doctors are not casting fractures anymore.
I have noticed that.
Yeah.
So I have people and I'm like, why aren't you in a cast? And though this be in a boot?
Yeah.
Or...
Because progressive loading now is what is everything in the healing is moving in that direction. So if it's a fracture that way, a strain, sprains, everything, the whole idea of the Rice principle or the Price principle of protect, rest, ice, compress, and elevate is really sort of formed not on good science. So now there's a whole series of different acronyms that people are kind of using, but it comes down to respecting your pain first and foremost. But inflammation is a normal part of the healing process, and your body's way of taking care of itself. So, you don't necessarily need to put ice on something to kill the inflammation, because prolonged inflammation, can lead to a whole host of other issues. But generally getting it moving, progressive loading in a way that's not causing you horrific pain, and then gentle strengthening and gentle stretching to help those tissues heal is the best way to do that. So even with people who've had, a back injury from, lifting, deadlifting is a great example, right? You find people that want to lay around and not do anything. And of course, you're not going to go right back and deadlift a barbell, but there's ways to modify those activities and calm the muscles down and retrain that movement pattern so that you're not losing more strength by laying around on the couch or not doing anything. So generally speaking, if it's neck pain, back pain, muscle strains, we're get up and take a walk. It's going to help the body kind of get all those fluids flushed through the tissues and get those healing processes started.
This brings up another point as well with, physical therapy is often we grew up on that. I grew up on the Rice principle, and science is always changing. So as a parent, you go off of maybe what you already know, and with an injury, it's important to see a doctor and see a PT because so much is changing.
Yes.
There may be a better way to take care of it, because you could actually maybe causing more problems than you realize.
Right.
So the big piece of it, we'll touch on this real quick. how do you pay for all this? How does insurance work with physical therapy? And the one thing that is great with physical therapy is it is very insurance friendly.
It is. Yes, it is.
So share with us a little bit of the steps. You know, I've noticed something, I want to, or, you know, I've seen this, I want to get my kid in and check before, you know, they start their baseball or football season.
Right.
What do they have to do?
So the beautiful thing about all 50 states now is that all 50 states in the U.S. are direct access states. So if you have what you think is an orthopedic complaint, musculoskeletal, neuromuscular, you sprained your ankle, you twisted your knee at practice or whatever, something hurts, you can go right to your physical therapist, which will cut the wait time, you know, by a ton. You know,
So they don't need to get a referral.
They
They
don't
can
need
go
to get
ahead
a
and
referral.
make an appointment with
Right.
somebody in their group.
because
Okay.
as you and I both know, it sometimes takes forever to get into your doctor, right?
Absolutely.
And you might as well get things started if you can by going and seeing your PT right away. So you can get that done, get that whole kick started, and insurance will cover that first visit. Sometimes insurance companies will then require you to have a signed plan of care by the doctor afterwards, but that's as easy as the PT writing up their initial evaluation, sending it to the doctor, and then having the doctor sign off on, you know, what the PT and their patient came up with as far as goals and a plan to progress forward. So that's an easy way to get that taken care of. Insurance companies are all different in what they'll cover, you know, and how many visits you'll get and how much they're going to reimburse and this and that, which is a whole other can of worms. But generally speaking, most insurance companies will cover a plan of care.
Awesome. So don't wait.
Don't wait.
Just give a call and,
Yep.
and get in there.
Yep.
So before we wrap up, your website. Share with us your website.
Yes, so you can follow me on my website is streamlinephysicaltherapy01.com. I'm also on Facebook and Instagram and
Awesome.
TikTok. Don't go on TikTok, but on all those things.
I still haven't made that leap over into TikTok yet. And your office is located?
It's Inside Sports Advantage in Verona.
Okay, wonderful. Well, thank you for your time
Yes, of
today.
course.
This is valuable information for parents.
Yes.
Thank you for tuning into the Parenting Game. We are on Facebook and Instagram.
Thank you for watching The Parenting Game. All episodes of The Parenting Game are available on demand at sunprairiemediacenter.com.